Good afternoon. On Wednesday at midnight, the island will have been locked down for 14 days, and I'd like to begin by thanking the whole community for engaging with this quite extraordinary restriction on personal liberties. Understanding of and indeed compliance with the rules has not been perfect, but it has been very good. So thank you to all of you for following the requirement to stay at home. In doing so, you have saved lives by helping to break the chain of the virus's transmission in our community, and we'll talk a little bit more about that in a moment. We must acknowledge how difficult lockdown is for so many people, not only those struggling with anxiety, with loneliness or social isolation, but also now those who are experiencing job loss and financial hardship, as well as those who are unable to see loved ones, particularly, of course, elderly relatives being looked after in the care environment. To be so close and yet kept so far apart is tough. We imposed mandatory self-isolation on the 19th of March for any inbound traveller. We closed pubs and clubs on the 20th of March. We closed schools early for Easter from the 23rd of March. And of course, we introduced lockdown on the 25th of March. So the question, of course, is it working? And I'm going to leave Dr. Brink to talk in a little bit more detail about the statistics. But the evidence is emerging that the strategy of acting early and trying to stay one step ahead is indeed working. And whilst we have sadly had 4 deaths, actually only one of which would have been reported as a COVID-related death in the UK, the testing regime and the contact tracing has identified cases that would not otherwise have been identified, meaning that the majority of cases are clusters, with in fact only 13 positives coming from unidentified community transmission or seeding. And we've had no one require critical care yet, and 34 individuals have fully recovered. In short, the strategy is working, remembering that the objective was never about preventing all cases, which would be unrealistic, but it is rather about flattening the curve, a phrase that we've used so much, ensuring that our healthcare system is not overrun and we can best treat those who do indeed need treatment. But we cannot be complacent, and I think particularly in Alderney and Sark, which of course have had no positives yet. The experience so far here in Guernsey is no different to other jurisdictions, and that is, of course, that the oldest are the most vulnerable, which means that the older populations of the other islands are at greater risk, but have even more fragile healthcare systems. So, whilst so far so good, I must level with you once again and tell you that we still have a long way to go to get through this together. When I announced the lockdown, I said that it would be for an initial period of 14 days, but I warned that the island should prepare for it to be for 28. The Civil Contingencies Authority met yesterday and received, reviewed, and of course challenged the evidence and the advice led by Dr. Brink. We agreed at that meeting that the lockdown does need to continue for the remainder of this week and next, during which the position will remain under review. The lockdown is subject to some minor changes with which the Committee for Health and Social Care agreed yesterday, and Heidi will speak to that in greater detail. These provide that businesses, excluding takeaways, that can home deliver may resume doing so from tomorrow, provided, firstly, that all sales and orders must be taken by phone and online, not face-to-face, and secondly, that the deliveries are following strict public health guidance on how to deliver safely, including the use of one delivery person. It's simply not possible to maintain safe social distance with more than one person in a delivery vehicle. Now, the change will self-evidently mean that there are more vehicles on the roads, but I think we should all actually welcome that as a tiny, perhaps a baby step towards a normality that will help the whole community. To be very clear, the first priority was, is, and will remain public health and minimising the loss of life from COVID-19. The second priority was, is, and will remain the resumption of normality as swiftly as it's safe to do so. This self-evidently is in the interests of the whole community's mental health and well-being, as well as the economic well-being of individuals, families, businesses, and of course the public finances. We announced financial packages to support continued employment in the immediate term and to keep help businesses through their current cash flow problems. But we are also thinking further ahead to the next wave of economic challenge we will face. We do not want lives, livelihoods and businesses to be lost from experiencing overwhelming economic challenge. So I can reassure you that we are actively developing an exit strategy from lockdown and a recovery strategy for the economy, and it is likely to be staged. The pace at which we can unlock will be driven by the bailiwick's experience in managing COVID-19, in which everyone can play their part by complying with the public health directions and hygiene advice. And it will be driven by the evidence and the data, the quality of which is improving daily now that we have our own online, on-island testing. For example, the next stage could well be in relation to solo outdoor workers. And we'll also need to make some decisions next week ahead of the scheduled start to the school term 2 weeks today on Tuesday the 21st of April. Some will think that we need to move more quickly. Some will think that we need to move more slowly. Some will be frustrated. Some will be nervous. Some will think that a particular activity or sector should be unlocked, or whilst others will think the opposite. So, frankly, I'm under no illusions how difficult this phase will be and how it will itself place stress on the community. It may even make the decision to go into lockdown look easy. I've said several times that we may make mistakes with this. We may move a few days early or a few days late, but please never doubt our intent to make the best possible judgments we can. These are very difficult decisions which we will continue to make based on evidence. They will be proportionate and they will be designed for the bailiwick's needs. And our success in making them, of course, will only ever be judged later with the benefit of hindsight. So I say this to you. You trusted us as we took you into lockdown, and I need you to trust us when we take you out of it. I want to just briefly cover off a couple of other matters. I want to mention some regulations which the Civil Contingencies Authority made last Thursday. These deal with a range of issues, from the temporary registration of health professionals, for example, those coming out of retirement, temporary arrangements in relation to death certificates and cremations, temporary changes to the mental health law and provisions in relation to some health and safety legislation and parish meetings and so on, as well as actually in relation to the cutting of seaweed to allow our local producer of hand sanitizer to continue production after mid-April. Now, all of these may seem quite an esoteric collection of matters, but actually it's yet another example of planning ahead, seeking to ensure that we have the powers before we need them, rather than simply reacting when we actually hit a crisis. And finally, with regards to the ever-present challenge of securing enough PPE, personal protective equipment, together with colleagues from Jersey, I spoke yesterday with one of the ministers in the UK health team, and we were pleased to receive the assurances that we were looking for in relation to our supply chain of PPE and the identification of a clear communication routes in the event that any concerns do emerge. And we clearly cannot be complacent on this issue because there is a global shortage at the present time. But we are doing everything we can to ensure that that challenge does not become a problem. So with that, I'm going to hand over to Heidi, and then we'll move to Nikki. Heidi.
Thanks, Kevin. And as Kevin has said, we need to continue with lockdown until 23:59 on Saturday, the 18th of April, in order to get a better idea where things are going. However, it is apparent that aside from the clusters in the care homes, things have been going well, and we don't at the moment have evidence of widespread community seeding as a consequence of the way islanders have heeded the message to stay at home. We really do understand how difficult this has been for many of you, and it's not something that we have had a pleasure in doing, but it does look so far that it really is making a difference. You're all making a difference. Now, although we're not lifting the lockdown, we do believe that we can make a change in one area, and that is in respect of home deliveries. Up to now, only essential items could be delivered to homes. From tomorrow, it will be possible for non-essential items to be delivered as long as certain criteria are met, as follows. The goods can only be purchased online or over the telephone. Other than essential retail outlets, shops are not to open their premises to customers, and only 1 or 2 people may work on the premises to take and fulfil orders. Social distancing and hygiene guidelines must be followed. Businesses may use couriers to deliver items, and couriers are designated as essential service providers, or a business can use its own delivery facility. However, the following delivery rules apply. Goods must be packed for delivery by no more than 2 people in line with social distancing and hygiene guidelines, including the wearing of gloves. The deliveries must take place as part of a planned itinerary, and goods must not be sold by delivery drivers to other parties. The deliveries must be undertaken by no more than 1 individual wearing gloves. A 70% alcohol hand gel should be rubbed on the gloves between deliveries, and the goods must be left on the doorstep of premises or in an agreed outside place. There must be no direct customer interaction. Of course, retail outlets don't have to provide this service, and neither should they if they can't meet the requirements. These rules will be enforced, and if we find businesses aren't following them, or not following the spirit of them, we will have no hesitation in tightening up the directions again. This is not about business as usual. The members of the Committee for Health and Social Care have considered these changes very carefully and at length. We have obtained assurances from the Director of Public Health that as far as she is concerned, they represent an acceptable risk, taking into account the increased activity that it might cause, ability to maintain social distancing and hygiene rules, and at the same time, the wider benefits both to businesses that abide by the rules and to the community in terms of supporting mental and physical health at what is a very difficult time. We are constantly reviewing the situation alongside Nikki and her team to ensure that any action we take is appropriate and proportionate at any one time, and we'll continue to do so. I hope that whilst we can't lift the lockdown yet, it may make the next few weeks more bearable for many of you. Thank you.
Great. Thanks, Heidi. Dr. Brink.
So, thank you very much. And as Deputy St Pierre said, we sadly had our 4th death, and once again our condolences go out to the family. What we're going to do moving forward is we're not going to talk about every single death. It's not that they're any less important. Every death, the public health team, and indeed the whole island, feels really acutely, and our condolences go out every time to the family and friends of those individuals. But if we move on and look at where we are, we now have 166 positive people on the island, but encouragingly, we now have 34 people that have totally recovered. And if you recall, we define recovery as the absence of us being able to detect the virus on the throat and nose swab, together with the person feeling clinically well. So most people will have that test on day 14, but if they're not quite well on day 14, we might delay it for a couple of days after that. And we're very pleased that 34 islanders have totally recovered and are completely well. As we've moved on, we've also got more intelligence about the groups of people that are infected. And encouragingly, when we look at our community seeding, now those are people who we've identified infection in through symptomatic testing and who we have no evidence of either travel or contact with a known positive. They're just people that have popped up in the community, and that accounts for less than 10% of cases. So we're getting good intelligence on that, and that's related to our widespread testing. We also are getting very good detection amongst our contacts. So about 25% of our cases are diagnosed in contacts. Now, these are people who we've identified as a contact of a confirmed case. We've asked them to go into self-isolation. They've self-isolated themselves, subsequently become symptomatic. We've then sampled them when they're symptomatic and found them to be positive. Now, this is really hugely important because those people haven't been in contact with the general community. Because they've been in self-isolation, they will have almost no contacts at all. Sometimes they'll have a small number of household contacts. But that is hugely beneficial to stop that chain of transmission. So the fact that we're able to get that data together is really important. We continue to look at our age range, and our age range again goes from under 1 to people in their 90s of people acquiring the infection, and we've got a roughly equal male-female split in the gender of the people getting infection. One of the things I wanted to focus on in more detail today was the issue of masks, because obviously that's very topical. So the World Health Organization issued some new interim guidelines yesterday on the use of masks. And I think the use of masks in clinical settings and in symptomatic people, I don't think that is a matter of dispute. The issue is the use of masks in the wider community in people with no symptoms. And one of the things I'm really concerned about is we must not use the use of masks to lull us into a false sense of security. And that's really important. So if people are symptomatic, I do not want them putting a mask on and saying, great, I can go out, it's absolutely fine. It's not fine. Symptomatic people need to stay at home in self-isolation. So I think that's really important. We also have got the huge advantage of having more data with regard to from our testing program, and that's given us some very useful information. Now, when we've looked at some of the groups of people we've tested, we have found people with little or no symptoms actually coming up positive, and that's really important as we look at how we devise our strategies, what is right for us and our community. Interestingly, some people have very minor symptoms, with the loss of the sense of smell being one of the most common things that we come up with. So that's really important. So then that comes back to the issue of cloth masks. Surgical masks need to be used for healthcare workers and in healthcare settings. There's a worldwide shortage, and we'd ask please for people not to use them in the community when they have no symptoms at all. But if you look at cloth masks, one of the issues I brought up with you before is that if they are not properly used, they can in fact represent a risk to that person. So if you are going to use a cloth mask, you need to launder it properly, you need to tumble dry it, you need to iron it. So all of that is really, really important. So it comes to what our recommendations are, or what our thoughts are with regard to cloth masks. And we reviewed all the data. We spent a lot of time over the weekend and into yesterday evening looking at what the data is. And our conclusion is that we would support people's personal choice to use a cloth mask in the community if that's what they choose to do. And I think that is balanced based on the recommendation. I think people need to be cognizant of the fact that using a mask actually isn't going to so much protect them from infection, but might prevent them from transmitting infection. And I think that is really important. So the public health view is that we'll support a personal choice with regard to the use of cloth masks, as long as people don't use it when they're symptomatic to be out in the community, because that's an absolute no-no, with all the caveats of using it properly and with all the caveats about laundering it appropriately, changing it when it's wet, and so on. So I think that's really, really important. So we feel that's the most balanced approach based on the evidence we have. And I've always sat in front of you and said that we'll look at our advice would be based on the evidence that we can get. So that's our recommendations with regard to that. We're going to continue to monitor the situation, and if anything changes, we will, of course, review the evidence as it comes up. Thank you.
Thank you very much. Peter.
Thank you. I'll touch on 4 areas today. First of all, the hospital. It feels really quiet, actually. There's a sense of sort of waiting for things to develop. And anyone who's been there, and most people have stayed away, thank you. But anyone who's been there will know it feels a very different place to how it felt 2 or 3 weeks ago. I want to emphasize the hospital is there for people who need it, because we're seeing some people presenting perhaps later than you would hope with things that we could have helped them with. And if you think you need to attend the emergency department, if you need medical help, we are there for you. It's not closed to all business, and please don't wait for your symptoms, for your conditions to get worse before you seek help. If you need help, please come to us. So the hospitals feels like a sort of poised, ready for action place at the moment. We only had 5 patients in our suspected COVID ward this morning, and 2 of them we're hoping will go home today. They may have gone by now. So that's the hospital. The care homes are really the front line for a lot of our population at the moment, and we just want to say that for a couple of care homes where we know there's been issues, we're doing all we can to support these homes, because it's a big challenge. So we've been sending staff to help out, PPE provisions. Primary care have allocated a GP per care home, and there's been lots of input there in terms of getting care plans in place for everybody in the home, and that's all going ahead. But we know that people are working under difficult conditions there, and we're doing absolutely everything we can to help in that position. Personal protection equipment, we've touched on it. There's a worldwide shortage. We have supplies of everything in stock. We completely adopted the new NHS England guidance for personal protective equipment for hospital staff, but not just hospital staff, right across the board, staff in care homes, pharmacies, ambulances. The guidance is really helpful. It's clear. People can see very clearly from the tables what they should be wearing for what sort of patient, and we are fully supporting them in doing that. So we have the equipment that we need. We're using it really carefully. We're keeping close control of the stocks we've got and allocating it to places as they need it. We have huge amounts of orders waiting still, and we have equipment in all areas. So we're content with our position, and we're keeping a close eye on it. I think those are the things I really wanted to touch on today. Thank you.
Great, thank you. Just one question on the PPE, which comes up frequently, is a lack of understanding of why there is different PPE in different environments.
Yeah.
Now, you've touched on it before, but I think it's worth just explaining again that actually what you may use in a care home may not be the same as a hospital. Why is it different?
Absolutely. So the guidance for the guidance that the NHS have published it's best summarised in the tables. If you want to hit their website and look at the tables, it's really clear, because they tell you for a known COVID patient that you have to be within 2 meters of, you must wear your apron, your mask, your gloves. Those are all ticks in the boxes for those things. If you're doing anything that generates aerosols, and for example that might be if you have to do airway work or induce, physiotherapists might have to induce coughing, that sort of thing, they need to be wearing different types of masks and full-length aprons, and that's all described, who needs to do that. But for patients where we don't suspect COVID, we're taking normal precautions, and again, we've got a difference between suspected and positive COVID patients that's clearly described in the tables. So we just ask people involved in healthcare know about this guidance, use the charts, use the PPE that's appropriate for what you're doing, and we'll make that available to you.
Thank you very much. Paul.
Yeah, as we move into a further period of lockdown, our thoughts undoubtedly must go to our frontline health and care workers. As mentioned by Dr. Raby's, circumstance has dictated that our private partners, specifically those who care for our elderly and those in the public service community teams, are now facing extraordinary pressure that this pandemic brings. More than 100 from the community have now responded to the call to support our carers, and we are humbled by this response and say thank you. Others have mentioned a sense of guilt in staying at home and not physically being active in work or in helping or supporting. You are helping, of course. Staying at home not only supports our health and care workers, but also supports all our essential workers. There are too many to list here, and they come from the private, public and third sectors, but they include the people that keep our electricity on, clean water coming out of our taps, our rubbish collected, even the milk in our tea, and of course the food on our supermarket shelves. The updated guidance for the next 2 weeks is designed to support the community to continue to stay at home. Even with the most robust business continuity plans, a significant outbreak in any of the areas I've mentioned and many others could affect the way that you are supported by these essential workers. Please support them and your community by continuing to follow the advice. Relevant to today's changes are the amendments. Updated business guidelines will be available after this briefing on www.gov.gg/coronavirus. In terms of information, page views to our website have increased since the beginning of March from an average of just over 5,000 daily to almost 40,000 average daily. We are aware that this affected the speed of the website, so over the past weekend we have rebuilt with greater resilience, and so on Sunday published new pages and are carrying all the information that you need and all the contact details should you still have questions. If you are a retail business unsure if you can trade under this new guidance and the amendments, please visit these pages in the first instance. If you are still unsure, contact details are available here so that you can contact our team directly. We have now paid around $500,000 in business support. If you are a business who needs help but hasn't yet applied, please go to gov.gg/coronavirus again for details on how to apply. If you put in an application but not received funding, then please bear with us while we work through this process and be assured that all available resources are working on this. Daily calls and mails to the team administering the hardship fund continue to be in the thousands. Again, we're here to support you and we'll deal with these inquiries as quickly as we can. Since Friday, we've had an additional 700 people sign up on our community tool. Details of how to sign up on information on the data this is giving us is available again at gov.gg/coronavirus. I continue to encourage you to sign up so that you have a detailed insight on what our community needs. Thank you.
Okay, thank you very much. So we'll open up to questions. So who wants to kick off?
It's quite a local question. I'm Rosie Alsop. I'm from Island FM. There are ormering tides on the 8th, 9th and 10th of this month, and we've had a listener call and ask, will they be allowed to go ormering?
Yeah, we can't see any reason why people shouldn't be allowed to go ormering. As long as they keep their social distancing guidelines, it should be perfectly fine. And it's a good way of being able to chill out and have a bit of exercise.
Good. Next question. Yep.
I'm Maisie Foote, I'm from Bay Oak Express. Are you able to confirm whether any inmates or staff at the prison have been tested for the virus, and what sort of measures are in place if that were to reach the prison to stop it from spreading?
Paul, is that a question for you?
I have no data to date whether prisoners have been, or offenders or staff have been tested for coronavirus, but we have significant contingency plans on how we'd manage this situation if it did impact the prison.
Yeah. On behalf of, I'm speaking on behalf of somebody, Rob.
Yes, yeah, Rob Moore from the States Comms team, but asking a question on behalf of ITV Channel, who are following the briefing remotely and submitted this question for Dr. Brink. What difference is on-island testing making, and when do we expect to see the start of antibody tests?
So on-island testing has been a game changer for us in that it's enabled us to look at the real-time management of the pandemic as it affects the bailiwick. From our perspective, it also helps us. For example, we had a potential issue in a small community home over the weekend where they were concerned about a few people. We heard about it on Saturday. We tested Saturday night. We could say by Sunday morning that this wasn't anything to do with COVID-19. So it enables us to manage a situation acutely and quickly. So that's really important. The other thing about on-island testing that has been hugely important is it's giving us a wealth of data. So not only on the risk factors for infection, but for example, it's enabling us to map what we think is our community seeding. Now that is pivotal to informing Deputy St Pierre and Deputy Salisbury if we want to look at then moving towards a lifting of the lockdown. This is never going to be a risk-free environment. We're always going to be balancing benefits and risks. But what we're seeing from this is not a lot of community seeding. Now we need to model that impact over the next week or so to see if there's any further seeding, but enable us to provide the evidence to underpin our decision making. Now we're not going to get it right every time, but what we're going to do is use the best evidence we can to make our decisions, and that's all we said to the population of the bailiwick when we started, is we'll try and use local evidence to determine what we're doing, and testing has been pivotal to that. With regard to the antibody tests, there are concerns about the quality of some of these tests. So, for example, if you take an antibody test on day 5 of having symptoms, there seems that only about 20% of those antibody tests are going to be positive, going up to about 50% by day 14 and going up to about 80% by day 40. So I think with regard to antibody testing is we need to make sure that any assay that we use is of high quality and gives us reproducible and reliable results. And so we're looking at those. But I would envisage antibody testing to lag behind our direct virus testing, which is what we're doing on the throat swabs, to then give us some idea of population-based immunity. I haven't seen reliable antibody tests to be used to diagnose acute infections. And as I said, 20% positivity when our throat swab assay is probably close to 90% accurate. So we've really got to look at using the best test for the clinical situation. So sorry, rather a long answer, Rob, but it needed a bit of an explanation.
Okay, thank you very much.
Ewan Duncan, BBC Guernsey. One for you, Nicola. A week on from on-island testing, what have you learnt from that? And also, are we now seeing an acceleration in the amount of testing you're doing, and specifically for health workers at the front of it all?
So yes, we are seeing an acceleration of the amount of testing, and yes, we are testing more healthcare workers, and so that's been very useful from that point of view. So we're testing more. We're also learning more about how people present. So, for example, when we've tested some people, they've had very mild symptoms. So certainly not the cough or fever or shortness of breath. And some, as I said, quite prominent has been a loss of smell. So we're learning more about how this virus presents, but it's also then helping feed into our other advice. For example, the advice that we've given on masks has been related to our knowledge of what's going on in the community, but also the symptomatology of the people that we've tested. So we're trying to collate all of that data to make sure that we provide the best possible advice we can based on what we know.
Just another question about testing. You're saying that people are testing positive and they don't really have many symptoms. Are we seeing a change in the virus at all?
There is some sequencing data on sequential viral isolates. To date, the virus hasn't shown much sequence variation, but it is an RNA virus, so it is going to be inherently error-prone in its replication. And so from that point of view, it is possible that we might see change with time. But to date, we haven't seen much change on the sequence data I've seen. I haven't looked at it for the last 5-6 days, but when I looked at it about a week ago, there wasn't much variation.
And, sorry, to do with community spreading, how confident have you been in, since we've been in lockdown, that you've seen a reduction in the amount of numbers? You know, we haven't seen much in the community, but if this carries on with the current trend, will we be likely to move away from lockdown measures moving forward?
So certainly the aim of lockdown was to get on top of any community spreading, flatten the curve and preserve our hospital assets and look after the health of the population. So that was the aim of that. So yes, if community spreading seems to be static or decreasing, then we can look at how we come out of lockdown. And again, it's using evidence to move out of lockdown. And it might be that we move out of lockdown and we get a burst of viral replication again, and we then move back into lockdown. So that honest dialogue with the population, with all of you, is so important, because I think if people know how we're thinking, they can manage their expectations. And we've always had that very open approach because we feel it's all of our problem.
Good. Just in relation to Nikki, and just following up on one of Ewan's questions there around symptoms and the fact that you're experiencing different presentations, What's your advice to those in the community who do have symptoms other than the three that were originally advised, in terms of contacting the primary team sitting at the Chest and Heart Clinic?
Yeah.
Who should and who shouldn't be making contact?
I think if anyone's got any concerns, I think they should contact and have a discussion. Sometimes what they'll do is one of the GPs will give public health a call, and we'll have a discussion on the circumstances. I think if anyone has any concerns, we'd prefer to hear it from them than not hear from them. Particularly, as I said, we're learning a lot about the virus. In older people, the presentation, again, you sometimes see respiratory symptoms, but sometimes it's a bit of diarrhea, a bit of not feeling themselves, lethargic, and so on. So it's having a heightened awareness that this is a new virus that's recently entered our population, and we need to be sure that we understand exactly what this virus is doing.
Okay. Next question.
Danielle Keneally from Guernsey Press. I know that you appealed recently to people in the community who've had community care experience to come and help in the community sector. I wanted to know what the assurance was that had been given to them, that they could possibly be more at risk and they're passing it on to their family if they do catch it at home.
Who's best placed to deal with that? Peter?
Have a go.
Yes.
First of all, we're really blown away by the response from volunteers in Guernsey. Actually, we've had a fabulous response every time we've put out an appeal. So thanks to people in that position. I don't know the details of which volunteers have been asked to do what. So this is just general. But if you're volunteering and we ask you to help out, we need to make sure that what we're asking of you is safe for both you and your family, and safe for the people that we're asking you to assist with. So every case is going to be looked at in some, case by case, and we will give advice. And if somebody's volunteering but has vulnerable people at home, we may have to turn you down, actually, because some people probably shouldn't be exposing family members to the virus in any way at all. Remember, for most people, this is a mild illness. For most people, if they get it, they'll be absolutely fine. But we have to protect people, and that's what we're doing. So please volunteer, but please let us talk you through exactly what roles are safe and suitable for you.
Paul.
Gavin, just to add, there is new advice, refreshed advice going out online today available for volunteers in terms of what precautions they should take. That's across the sector. That'll be available from today.
Okay. Any other questions? Yeah, Ewan.
Obviously, today marks 2 weeks tonight. Do you think that islanders should have slightly more advance warning if you're going to extend the lockdown? And also, what sort of update can you give us on the schools reopening?
Well, as I said when I opened, we will continue to keep everything under review during this period. And as we have tried to do throughout this, really from the beginning of March on, to have, as Nikki has said, an open dialogue through this, through these media briefings, but also directly with the public. So there is transparency about what we're doing and why we're doing it. So I've always been very cautious about over-promising and under-delivering when it comes to timeframes. I don't want to, as I've said before, put a circle around a date on the calendar and say on that date a given decision will or will not be made. So we are very conscious, as Heidi has said, about the implications of the environment which the whole community is now in, not least, as we've said, on the mental health and well-being, but also fundamentally on the economy as well. So it is in no one's interest that we remain in this state for any longer than is necessary to protect the community in the best way we can. In relation to schools, as I said, that again we do clearly need to give some advanced thinking to that ahead of the schools which are due to reopen 2 weeks today. So that probably means that next week those decisions need to be made in order that the whole education service, and indeed of course parents and pupils themselves, can plan accordingly. So we're conscious of those sorts of deadlines which do drive the need for decisions. But generally speaking, the approach will be we will communicate as quickly as we can when a decision has been made. Heidi.
Yeah, Gavin's absolutely right here, and also things have changed very quickly. I mean, in such a short space of time, you know, everybody could go about their business doing whatever they wanted only 3 weeks ago, and now everybody's told to stay at home. It's the evidence is changing all the time now, and it's from yesterday, from the latest evidence that Nikki could present to the CCA and to HSC, that we could make that decision. It's not something where it's not like government used to be, where, well, we'll think about it and we'll go out for consultation and then we'll consider what the best way of doing it is and whether we got the staffing for it, and then we'll go to Treasury. These are real decisions that we have to make real time in the moment, and so it's difficult to give people so much advance warning. But as Nikki said, in particular, it's just about having that dialogue, saying where we're thinking of going and what will happen. But it's very difficult to actually say on the 18th of April we will be doing this right this moment, and it's all about the evidence. I say it again, as Nikki does all the time, it's all about the evidence. As we get more and more evidence, we can then decide what is the right thing to do at any one time.
Okay, next question. Yep, amazing.
Dr. Brink, I know last week you said there were 3 infants under the age of 1 who have contracted the virus. Are you able to confirm if there's any more? And also, how can parents who maybe have to take their children out when they visit the shop or something, how can they best protect them?
So, parents taking their children out to the shop is they should stay together as a family. So they should social distance as a family. So having your child run around the shop and so on would put your child at a potentially increased risk. So I always say to a family is that if you're going to go out, if you're living as a family, move as a family. So, and I think that's really, really important. Fortunately, the under ones have done really well. So that's really positive from our point of view, and in fact weren't very unwell at all. So that was really good. We haven't had any other cases under 1 year of age, but I'm sure we will see more. So our age range remains from under 1 up into the 90s.
I think just to follow up on you were trying to infer about people taking their babies out if they're symptomatic. I think Nikki would say that they should not go out at all.
Yeah.
And then that's where the families need to consider deliveries and not actually go out. And I think that's a really important point to make.
No, anyone who's symptomatic mustn't go out into the community, and that is really a message we want to try and drill home. That's so important.
And also, just to reinforce, so there's no ambiguity. If you can shop alone,
yes,
you don't have to go with anybody. Then shop alone.
Yeah,
You don't
exactly.
have to take the travel as a family does not apply when it comes to shopping.
Yeah.
If you only go to the shops with family if there is no other choice. Ewan.
We're seeing quite a few comments on the Facebook page just now, trying to clarify the difference between this new delivery service and why takeaway deliveries can't still happen. Can you clarify to us why that is?
Well, perhaps Nikki, you
I think
in that, and then,
from our perspective is, you talk about takeaway food, it's not to do with the delivery part of it, it's to do with the preparation part of it. So you have people going into a kitchen where they can't possibly social distance. We know that a lot of the kitchens are really small, so it's the delivery, it's the preparation component of it rather than the delivery component. So I absolutely accept the delivery side of it. There's no reason why that shouldn't be exactly the same. It's the preparation component. And we're in a situation where we don't want to have virus then seeding back out into the community. So it's for that reason. It's nothing to do with the delivery.
So I'll just reiterate what Nikki said. This does not apply to takeaways.
And Heidi, the exemption or the application can be made in certain cases for those that are preparing food for the community. Could
Absolutely,
you just explain that?
People can apply to HSC, and I think this through the trade at gov.gg probably is the best way of doing it. But people can, if they've got a valid reason and they say that what they're doing is adding value to the community, it is low risk, they can meet all the social distancing and hygiene guidelines, that is something that we can consider as an exemption. We are looking at in a couple of areas, because you can't, sometimes exceptions have to be made. We understand that. It's difficult to apply rules to absolutely everything, but they are exceptions, really will be an exception.
Okay. Yeah.
Sorry, I just want to follow up on another question on schools. I know that you sort of said you need to make a decision next week, but in terms of those children expecting to sit exams and also those leaving school. Will there be some sort of update in the coming weeks?
Yeah, I mean, again, that really is going to be a matter which education services are going to be looking at and going to need to comment on. And again, a lot of that is going to, of course, be driven by national policy decisions about how to fairly treat those that particularly are sitting, of course, national or international exams. So that, again, that's not something that I'm afraid I'm really in a position to comment on today. I don't know if you've got anything to add to that, Paul.
No, just to say, obviously, what's happening nationally with the exams, the schools and education here are having to follow along those guidelines. And I know from personal experience, we've been receiving advice and updates of information, if not the final answer. But I just go back in terms of the school return. Again, it's very much based on the evidence and the position of the day, and that feels a little bit slack sometimes of why they're telling us so late. You know, we've only got so many days left before the term. I think those decisions are going to have to come fairly soon. But again, we're waiting to get, as Dr. Brink has said countless times, to get the best possible picture and profile of the virus on Guernsey with the results from the on-island testing. That will give us our tolerance of risk to establish what can we actually ease off, as Dr. Brink says, in order to try and get a sense of normality. And that should come next week.
Yeah, so we'll absolutely give as much notice to any changes as we possibly can, but just accepting that in some cases it will be quite limited.
Got a question about tests and the availability of the chemicals to keep carrying out tests. Is there any shortage, or are those in plentiful supply?
They're not in plentiful supply. The reagents, there's a shortage of reagents worldwide. There's also a shortage of the swabs worldwide. So we're addressing both of those, and at the moment we've got reagents to test, but obviously that remains and swabs, that remains a continued challenge for us to access the resources required.
And there's no way that we can generate this kind of stuff for ourselves on island?
Not specifically what we require, to my knowledge, but I think the important thing is testing at the start of a pandemic while you're mapping what's going is probably the most important time. Is that because we can work out what's going on, what our level of seeding is. So the testing time is really, really critical now. But we're working with all sorts of external partners in our procurement to look at how we can try and ensure that we keep that supply of reagents and swabs coming on island, because we don't want to stop testing, as I'm sure you're aware.
Yes.
In the national press, there are reports of countries such as the US who are not allowing face masks to be sent to countries that they're intended for, and hijacking them for themselves. Is this the true for face masks that are intended for Guernsey? What are your thoughts?
Yeah, well, it affects us just like it affects the rest of the world. So if you know the big manufacturers aren't exporting, then we have to look at elsewhere. So yeah, it's a risk to everybody. And we've got big orders in. We've got enough on island to manage for the at the moment, and we've got orders in place. But absolutely, there's a worldwide shortage, and yes, some countries are looking after themselves in the first instance, and that affects us. Yeah.
Our procurement teams, I think, have been working really well, securing supplies. It's been really quite impressive what they've managed to do, and it's a relief, I'm sure, to Peter when he sees the big boxes land on a pallet arrive at the hospital.
Yeah, no, I'd echo that. The procurement team have just been absolutely fantastic. Yeah. They've been following up every lead. They've got orders in places we've never heard of, and the on-island response as well has been great. So yes.
And some of those leads have come from the community as well.
Absolutely.
So, for which we're very grateful. So, Ewan.
Just one thing, we often look at the national UK media and what's happening there, and obviously we think of ourselves in Guernsey, while it's not quite the same here, they probably think the same thing in Alderney and Sark. I know you touched on it in your opening, but what can you say about the lessening of restrictions for those islands?
Well, it's something that, I mean, Alderney and Sark are, of course, represented on the Civil Contingencies Authority, and it is very much a bailiwick strategy that is important. I think we've recognised, again, as I said in my opening comments, that one of the there are two particular challenges for those jurisdictions. One is their demographic is different to Guernsey's, and they have older populations in both communities, and of course their health infrastructure is more fragile in their ability to actually treat on island if required. So they are more likely to have cases that require treatment, and they have less ability to provide that treatment. So inevitably that would then put pressure on bailiwick resources in managing that situation. So that's why it's a bailiwick strategy, even though at the moment they would appear to be in a better position than not having had any positives. But certainly there is a regular dialogue in seeking to understand their particular needs and requirements, but there is a clear rationale which has been explored with the other islands as part of the Civil Contingencies Authority's dialogue and also, of course, with public health.
Yeah, I mean, it's like in the UK, certain parts of the country where you might understand why they've got a tight lockdown at the moment, whereas other more remote parts of the UK probably think, why do we have to do this right now? I understand that, but this is a bailiwick-wide approach, and what we're doing is based on public health advice and all the risks that apply to the bailiwick as a whole. And as Gavin very well said, the greater aging older population in those two islands and the more vulnerability of their healthcare systems.
Okay. Any more questions? Yep.
How many care homes in the island now have confirmed cases?
Is anyone in a position to answer?
Yeah, we've got confirmed cases in 3 different care homes. One care home has one case, and 2 care homes with more than one case, and some members of staff affected. So as I say, that's really where the front line of this battle is being fought at the moment.
And I think, again, either Nikki or Peter may be able to comment on this, again, by comparison, just picking up the previous question in relation to looking elsewhere. The fact that we are treating this as a whole island healthcare system and a whole island problem is probably a different approach to the UK, where actually the care home sector would very much be on their own until such time as they need to transfer somebody into a hospital. Is that right?
Yeah, we just have to stand together on this. Absolutely, it's the right thing to do, but it's the right thing for the whole island. That where a care home has a problem, we address it together, because otherwise we run the risk of it spreading. And not getting the best outcomes for people in that home or people who work in that home. So we put in all the support we can. Primary care have been great with the way they've engaged with it. And case by case, care home by care home, we're doing all we can to help. And we understand that it's really tough when you get a case in a care home.
So it's yet another example where we're doing things differently in Guernsey for good reasons, to meet Guernsey's needs.
Yeah, I mean, we are testing in the community. In the UK, they wouldn't be the positive cases in the care homes wouldn't be picked up, and it shouldn't be a blame game here either. This happens, and we know that it's a vulnerable area in terms of care homes. I think it's all about putting together and supporting each other in the first instance. Absolutely, and we've got a grip. We know what the figures are, and because of that, and because of the evidence we've got, we can make the right choices in how we care for people.
And I think just, again, whilst we're talking about comparisons with the UK, because again it's a very easy one for people to make, there are a lot of comparisons about the statistics. People say, oh well, per head of population, Guernsey has a high number of cases or a high number of deaths, and actually we're not really comparing apples with apples, are we? Because of the different testing regimes and the way we measure stats. I don't know whether either you or Peter want us to speak to that for a moment.
Well, we aren't, because the care homes aren't being tested in the UK. They're just being presumptive deaths. They've been clinically diagnosed deaths of COVID-19 in cases, so entirely different. And if we were reporting on hospital-only cases, we'd now be reporting on 7, wouldn't we? Yeah, so we'd be reporting on 7, which is very different from the 166 we said there. The other thing is that unfortunately the death rate also varies amongst different age groups, and I think that's really important as well. So you've got to take all of that into account when you look at the impact on a particular community. So again, it's looking at that evidence to map what's going on in the community.
Okay, time for one more question. Ewan.
Just wanted to touch on why, obviously everything's changing at the moment, but bottle banks, recycling banks, ones that are not sort of centrally picked up, is there any explanation why these have been closed? Just a couple of questions we've had on that.
Sorry, could you repeat that, Owen?
To do with recycling bring banks, some of them have been closed recently. Can you give us an update on that?
Yeah, I think the first steps, as we've talked about, was to try and slow down the rate of people coming to contact with each other, because obviously an obvious site where that would happen. Also, the amount of vehicles on the roads was also an objective to try and slow down the rate, the potential for accidents, call out for emergency services. So again, it's not a necessary position we want to maintain throughout. And again, we're waiting for that critical picture based on the evidence and the profile to say, well, what services could we ease off, sort of take the brake off in order to apply. But we're not there yet with that.
Heidi, did you want to comment further?
No, it's fine.
No, so I think it's a good example of something where, as we react to the change in evidence and the change in data, we will be in a position to make some decisions around what services can be switched back on and how further changes are made in exactly the way I was speaking earlier about quite possibly some of the low risk occupations that are operating outdoors on their own may well be the next stage, depending on where we go over the next few days and so on with the testing. Good. All right. Well, thank you very much indeed, and look forward to seeing you all again next time. Thank you.
I've got one. I've got two things to say actually. Firstly, just like to thank the teachers who've been going into the schools and looking after the children of essential workers. I think the latest statistics we've got is today across all schools, 126 children and young people are being looked after. So I'd like to give a big thank you there. But I've also got another very important announcement to make. And this announcement is specifically for any children or their mums and dads who may be listening. Some of you have contacted me as you're worried that there'll be no Easter egg hunts and the Tooth Fairy will not be able to collect any teeth that have fallen out. And I'm very happy to tell you that the Committee for Health and Social Care have designated the Easter Bunny and the Tooth Fairy as essential workers. The Easter Bunny will therefore be able to visit children in the Berwick on Easter Sunday, but with one caveat. Dr. Brink has advised that any Easter egg hunts can only happen at home with the people living in your home. And don't worry, the Tooth Fairy can continue to make essential visits to children's houses to collect any teeth that have fallen out during the current lockdown period. Dr. Brink assures me that both the Easter Bunny and the Tooth Fairy are fully briefed by Public Health Services to ensure all infection prevention and control measures are in place for these visits to take place. Thank you.
On that happy note, thank you very much indeed. Thank you.